Hi, my name is Dee, this is Greta, Trish and Suzanne, and we're nursing interns in the Institute of Technology in Tralee. We're just going to have an informal discussion about the transition from student nurse to registered nurse. So Greta, do you want to start us off?
Well, from the research by Wolf et al. 2010, new graduates need to be ready for practice. So it's imperative that nursing students are gaining enough experience on their internship, and this would include them being proactive with putting themselves forward for any tasks that they haven't already included, because it would be easy enough to coast through internship, but if they're ever to be competent staff nurse, they need to pick up their skills during the 9 months. So proactiveness of students is very important.
Okay. Trish?
Picking up from Greta's point there, so basically the issues that are out there when you transition to staff nurse is like you don't feel confident, you're anxious, you're stressed. The other staff in the world will be stressed then as well because you're not to their level yet. So in other countries like the UK and Australia, they have programs that are called mentorship programs, which seem to work out really well. So basically, you go on a ward and you have a nurse as a mentor. So you have that person to help you guide through areas that you're finding difficult, and you can get further training on areas that you need. And this isn't in Ireland at the moment. They do have orientation programs where you're orientated to the ward, which is great, and we need these as well. But I think it's an area, and it's shown from the literature such as Reset, that there's an area there that needs to be developed, and we definitely could do it in Ireland.
I think maybe leading on from the mentorship programme, which would be similar to what we used to, because we used to have preceptors with us. I think the important part would be it's assumed that student nurses and then interns are professionally socialised. I think that's something that needs to be worked on. I think we had a mentorship programme, because you're expected to be able to speak to the consultants, the MDT, you're expected to actively involve yourself and engage. And I think as student nurses, we tend to be in the background, we don't tend to do that. So I think that's an issue that could be addressed through the mentorship programme. Also, problem solving, we're used to referring back to the nurse. I think now we have to get ourselves into the mindset that we're now going to be the nurse. And I think in your internship, you can start thinking like that, and gaining confidence, you will, the transition from student to nurse will be a bit easier.
Push you forward, I suppose, away from the...
What do you think about that stuff?
I think it's very important as well. My literature from Myers Reading in French 2010, they say the same, that it is your responsibility as a student to push yourself during your internship. This is our transition stage, and this is the stage where we need to gain those skills, those confidence. For me, it's medication rounds, and it's something that I do know that I need to work on. And for me, it's every day to inform the staff nurse, can I do the medication round? Can I do this task? Just to gain your own knowledge and confidence and skills, and that it is very much up to you to gain those. No one else is going to push you or guide you, and because when you are a staff nurse, at the end of the day, you're going to be doing that yourself. So
it's definitely a skill that you learn because you associate the condition with the patient, so you remember the medications.
And even just to learn the medications, you learn from doing,
not just if you have a list of them. You might remember 3 or 4, but you're not going to remember 20 or 30. That's
really important to get out and do
real life and do it for real.
Yeah.
I think Newton and McKenna, they agree with that we need to feel safe and not be afraid of making mistakes, that we need to push ourselves. This is our last opportunity.
And it is to push yourself that you do gain confidence.
Exactly, and medications would be definitely my biggest area that I would be concerned about.
And just even while the medication rounds are going on, just to delegate other tasks.
Exactly.
Just to free up and just to make sure that all other patients are okay and that their needs are attended to while you are going and doing the tasks that you need to do.
Because we would have carers, and sometimes we have other students, so they're a resource that we could tap into, which means we are actually free to do the meds rounds.
And they're learning too.
They're still there, they're still being supervised, and it's the same. Do you have anything else that you want to add into the discussion? I think maybe because we don't have the mentor programme here now, I think we can use ourselves as a resource.
Definitely.
Because we've always been there for each other, and I think we'll continue that.
Teamwork.
Yeah, we're part of the team, and just because we're not in college anymore, even if we're not even in the same hospitals, we can still tap into that resource and go through things.
At the end of the day, in the 4 years training, you're not going to see everything that you're going to come across, and you do need to help each other out, and you're not going to be able to do everything on your own. So.
And we understand.
Yeah.
That's the thing, because we're all in the same boat, we're all having the same concerns.